All right, guys, welcome to Healthy Living Global. Welcome to today's live streaming on this channel. All right, I welcome you guys for today. I'm Health Educator Mike by name. This is Healthy Living Global, and as we all know, this is a platform for health promotion, disease prevention, awareness creation. This platform have been open for um, promotion of health to make sure that you live healthy. That's what this platform is all about. And we are very sorry for streaming at this time. This after 10 or in about 10:20 something, right? 20 some minutes after 10. It's unfortunate that we are streaming or starting at this time. Due to some certain unforeseen conditions, we still help in your continuous journey, all right, to this healthy life. It will still support your journey to healthy life always. So we are not backing down, we are not going on holiday, so we want to be streaming every day and giving you the informations. All right, so I said we have this some of them. Initially we mentioned a lot of them, right? So we started our discussions, right, on acne vulgaris, on the effect of the skin, all right, that is giving that particular um signs that you are seeing, and the only way you can be able to tackle it, you can maintain personal hygiene. You try to use a comedogenic cleanser. You use antibiotics, especially for chronic one, TCN or lincosamide, but it will be on prescription. You discuss with your healthcare provider if it will be needed, and we also instructed that you should reduce oily intake, or I think that have a lot of oils, olive granite and akara and other. So you need to reduce them so as to make you live a healthier life. So if you are joining for the first time, do well to subscribe to this channel and turn on notification. Please, very important. It's going to go a long way in helping you to stay on the know, right? So that you are aware even when we are streaming. Now, that of yesterday we discussed about our topic dermatitis, which is eczema, of which we explained as against the might we have been heard about this eczema before now. All right, eczema is not contagious unless if it become infected. All right, autoimmune can be a result of using of harsh, like harsh soap, soap that have a lot of fragrance, right, can the skin to be able to do bacterial infections. But if that barrier is not there, all right, if some proteins on the skin that are protecting it is not there, we discover that the skin will be prone to any of all this allergic reaction, all those irritations and so on, and it will lead the skin to become dried, and you have patches, scaly patches and dry skin, right? So that's what happens, and sometimes it can be very itchy, right? It will be scratching you excessively. So that's what happens, and we mentioned the ways to treat that atopic dermatitis, which we say you can even use some medication, let's say topical cream like hydrocortisone, all right, even a pyridine. There's many things you can use also, but talk with your healthcare provider, right? We are not prescribing for you on this channel. So talk with your healthcare provider on the treatment options. That's what we discussed yesterday, atopic dermatitis, aka eczema. Today we'll be discussing about psoriasis. Psoriasis. So we titled today's topic says psoriasis well explained, or psoriasis explained better. Right now, um what is psoriasis? What actually causes psoriasis? I want us to be seeing all this, visualizing, even though this one is mental before we now come with the right teaching aid, how it looks like, right? But I'll be giving the description. But the main thing, if you have any skin condition related to that description, you can still go to your healthcare provider and seek further help. So that is the essence why we are still doing it now. Immune disease, it is not contagious. All right. What happens is that it will make it to multiply uncontrollably. Right. It will begin to divide or multiply more than it can be shed away. Of course, this skin you are seeing is always shedding away. All right. Whenever you take your bath, okay, now if you can experiment this on your own. All right. Let's say you are done taking your bath, right? You just use sunlight, even though you have cleaned yourself and everything. All right, just use like a tissue, all right, toilet tissue, and try to scrub on your skin. You are done taking your bath. Is there any dirty that's supposed to be on your skin? No. So your skin is supposed to look fresh. No, nothing that's supposed to come in on your skin or something. But if you scrub your skin with that tissue paper, you discover you are going to see scrub something out that will still look like dirty, somehow dark in color and so on. So the skin is always shedding its dead cells. All right. So once any cell dies, it will be shed away whenever you are taking your bath. So if you are not taking your bath or not cleaning yourself as expected, it will lead to the clogging or the pores of the skin, which is that of acne vulgaris. But now, in this psoriasis, even though you are cleaning yourself, you are taking care of yourself and everything, you are taking your bath as expected, the skin is not shedding its cells, the cells of the skin. T cells is part of the immune system. When it attacks the skin, it will make it, but though not all the whole part of the skin at a time. There are some certain points it can attack at a time. There is even what we call there is even what we call psoriasis, no, of the cells, making it to produce uncontrollably or reproduce uncontrollably. Your skin will be we have a break, all right? It will just break. You'll be seeing it, and there will be a kind of an outgrowth, all right? If you have noticed such a thing, like there's one of which we use heel balm, right, to treat, all right, all those kind of skin condition of which you notice all those kind of break, you see it will have an outgrowth and looking somehow, right, on the surface. So we say that this is what psoriasis. And sometimes it can come to the nail, right? So I've mentioned a lot of it. Can be on the foot, it can be on the skin, it can be even on the joint, which we call psoriatic arthritis, all right? And it can still be on the nail. Before you know, you'll be seeing your nail, all right, something growing, you will be seeing an outgrowth on the nail. You don't know if you are cutting this your finger, and before you know it, some of them can even lead to the discoloration of the finger, all right? You see it looking dark instead of normal brighter color that it will give. So dermatitis, you say, is caused by different immune disease. It can be caused by heat, it can be caused by many things, right? That of atopic dermatitis, aka eczema. But this particular psoriasis is just caused by what? Only a sort of autoimmune disease where the T cells is attacking some specific areas on your skin, all right, telling the cells to replicate more than necessary, all right. It will now have an outgrowth, and before you know it, the skin will look somehow. Now, if you actually want to treat it, you want to control it, um, you need to seek medical help with your healthcare provider. But the first line of treatment is what? Immune system suppressant, which is like some steroid creams, all right, or even oral corticosteroid. But I'm not going to mention anyone so that you won't go and do self-medications, right? So you seek help with your healthcare providers, all right? Anytime you are having this psoriasis, all right, it can happen to anyone. or which I say that what is an attack of the immune system to the skin, making it to replicate or repair particular spot, leaving the that spot to become particular spot, leaving the that spot to become thick. All right, it will look thicker than other places. All right, once it's looking thicker than you are having a skin condition of which that particular place you can just feel it that is thicker than other parts of the skin, just like that. Nothing happened, you didn't have any wound, nothing, it just developed in that way. You just know that something is wrong in the system. When you go to the health center, they can rule other skin conditions out. They can rule out if it's a sort of atopic dermatitis that is giving you that. If not that, they can check if there is acne vulgaris. When they check all those things and discover there is no nothing like that, so they can do that particular checkup to know if it is psoriasis. If it's psoriasis, you may be using an antifungal cream. Use antifungal cream today, use it tomorrow, use it next tomorrow, thinking that all will be well, not knowing that you are not you have not done anything. Right, you have not done anything. What you have succeeded in doing is just spending your money, because what you are treating is different from what you're having. So which is the reason I keep making emphasis on diagnosis. All right, I keep making emphasis on knowing exactly what is wrong with you instead of going for empirical treatment or um, um, all this blind treatment. So whenever you do a checkup or you are having any of these skin conditions, in order to rule it out, you check with your healthcare provider to know if you are having any of these issue. If you have any of this issue, it's better you seek medical help. Once you seek medical help, you be properly diagnosed. All right, of course what I'm giving you is just an explanation, or maybe I'm giving you a description. Anyway, I'm giving you a description on what it can look like. All right, so when we get our teaching aid, you can see the pictorial representation of what I'm talking about. All right, you are going to see it. And when, in fact, even with this description, and I believe I gave the description right, I gave the description in the right way. I say once you notice any growth and any outgrowth on your skin looking thicker, all right, not all over anyway, some places on your skin is looking thicker than other places. All right, may need to seek medical help. It may be psoriasis, so you notice breaking of your, or you are having this continual joint pains. All right, joint aches always. All right, you may still need to seek medical help because of psoriatic arthritis. All right, so all those things are the things we're expected to know. Once you have any of these conditions, seek medical help, because something may be wrong that you are not aware of. But if you continue using antifungal cream or use antibacterial cream, or that topical ointment, or even cream, anyone, so you are using it, you think you are going to solve the issue, it may not be able to solve the issue. So you need to know what is happening to you, then you know how you are going to treat it. Is when you know what is happening to you, it will enable you to know what you are treating. It will be a guide, right, to the treatment. So once you know what's happening to you, it's like getting 50% of the solution to your problem. All right, once you know exactly the cause, almost everything you see have cure. If not for all these communicable diseases, even non-communicable diseases, that they are still test running the treatment, like all these high illness like stage 4 cancer, or even AIDS and so on. So like all these common illness that people have, all right, is something that can be treated perfectly. So when we know what is happening, we use exact drug that can be able to handle it and treat it as expected. So the reason sometimes I don't mention a lot of drugs here is that I'm feeling that what we call proliferation of antibiotics. All right, there is proliferation of antibiotics. So there is not only a weapon that you can proliferate, right? So even antibiotics that is wrong. In other word, we can say abuse, right? Many people are handling these antibiotics here and there, so a lot of people handle it. Even healthcare providers, non-healthcare professionals handle this antibiotic. They always see it um, where they can be able to get it. So that's why I say there is proliferation of antibiotics. So, and it's a challenge to our healthcare system. It's also a challenge to public health. So, that's just what we want to just push out today, right? So, if you're having any of these health conditions, you just seek medical help at once, and you are going to be treated. So, tomorrow we are going to drop another one. Sorry, we didn't start on time, so we are going to make today on just very brief. So tomorrow is another day. See you guys tomorrow. Once you have any question anytime, any day, you can reach out to me. If you don't want to, put it on the comment section on 070-88-611-262. 070-88-611-262. You can reach out to me at once, or if you want to ask any question, you can put it on the comment section. Once I see the notification, I'll come right away, answer it, and you get the right or correct answer for any of your question. I am always ready to be your guide. I'm always ready to give you what you need to live a healthier life. Let us take this healthy living to a global scale. That's what we do on this particular channel. See you guys tomorrow.